few years ago, a dainty little girl living in an orphanage in China was given the chance of a better life with her new family in America. Just a few months after her arrival, she suffered an unexpected stroke, which left her partially paralyzed on one side. With no documented medical history to help explain the cause of the stroke, a team of caring professionals worked with this precious girl to help her regain her ability to walk and talk again. Her progress, remarkable. Her life, an inspiration. Giving hope to others is a priceless gift that our therapists share every day. If you're searching for a career that improves the lives of others while enriching your own, rehabilitation services at Intermountain Healthcare may be just what you're looking for.
I have absolutely found the career that I think I was supposed to have.
I enjoy people, I enjoy being around people, I enjoy helping people. When I heard of this career, it seemed like a natural fit.
I absolutely love my job.
One of the most exciting things about a career in rehabilitation is the range of possibilities. There are so many areas that you can specialize in, and it's not only the variety in the field. The future is stable and filled with opportunity because of the high demand for rehab professionals. We'd like to introduce you to 4 career tracks in rehab services: physical therapy, occupational therapy, speech-language pathology, and audiology. You'll hear from some of our therapists at Intermountain Healthcare who work in each of these areas. They'll share how they got into their careers and why they love what they do. Physical therapists help restore function, improve mobility, relieve pain, and prevent or limit permanent physical disabilities of patients suffering from injuries or disease.
We work with individuals who have dysfunction and try to help them become more functional, treat impairments, work with patients that have had surgery, try to rehabilitate them, work with people that have relatively simple injuries as well, people that have hurt themselves at home and at work. We deal primarily with trying to get people back to their normal activities.
It's very diverse. You can work in a hospital setting with patients right out of surgery, or with burns and wounds or joint replacements.
In many respects, we're somewhat teachers. We're explaining the technical aspects of what we're doing in a very everyday manner.
We provide medical services at community sporting events like the Ogden Marathon and the Nissan Xterra.
This career is rewarding for me because the amount of resources that we have here.
We have a sports science team that's dedicated solely to doing research in sports science. We have a pool area that's one of a kind. We use the pool quite often for rehabilitation. And just beyond the gym and the aerobic area, we have the sports science where they do the acceleration program, where they do a lot of high-end training for high school athletes. A lot of the Olympic athletes come to the facility.
You're seeing people an hour to 2 hours, sometimes 3 hours a week, one-on-one basis, so you're talking to them and you're getting to know, what they do. So you actually do develop some pretty close relationships, which would be different from other health professions where you're maybe seeing someone for 5 minutes and then they're gone for months or weeks at a time.
The most rewarding part of it is that I can help people realize that they're able to get better.
You can start by becoming a physical therapy assistant, which generally takes 2 years. To become a physical therapist, you must earn a doctorate in physical therapy. Occupational therapists help patients who have suffered from an injury or illness to restore their ability to perform activities in daily living, such as eating, driving a car, and getting dressed. They help patients regain the function and mobility to be self-sufficient and return to work.
Occupational therapy is involved with the patient in terms of teaching them or showing them or working with them to improve their ability to do activities of daily living.
We are focused on trying to get a person back to a lifestyle that they are used to improve their life and what it was before.
We do specific strengthening exercises. That might include lifting weights, that includes stretching. Sometimes a nerve can be compressed. We do nerve gliding exercises to help them relieve that compression. We do a lot of range of motion. People that have sustained fractures, sprains, strains tend to lose their range of motion, and so we will work with them to help increase that range of motion.
If someone was injured from, let's say, a stroke, and they were paralyzed from one side down, and their hands and their arms and their legs, they just can't move as well. We start off with the basic everyday skills, getting them dressed, getting them to bathe themselves, maybe getting back into their career or driving, getting them to take care of themselves.
I think occupational therapy has given me many opportunities that I might not have had in other types of career. You actually work with people, you touch their lives, you touch their families' lives, and it's nice to see that progression.
You can start by becoming an occupational therapy assistant, which generally takes 2 years. Occupational therapists must successfully complete an occupational therapy program and earn a master's degree. This usually takes 2.5 years after you have entered the program. You can also go on to earn a doctorate degree in occupational therapy. Speech therapists treat patients who have swallowing, speech, language, voice, and fluency disorders.
Often in speech-language pathology, individuals think that we just work with individuals that cannot speak correctly, but it is so much more than that.
The most fulfilling aspect of my job is working with the kids and feeling like you're making a difference. I think that's something that's so great about speech pathologies. There's so many different settings.
Speech therapists have opportunities to work with a wide range of patients, including newborn babies, Down syndrome patients, heart transplant, and cancer patients.
I also work with the newborn intensive care follow-up clinic 3 Fridays a month, and so I have a wonderful opportunity of meeting with parents and young children from 18 months to 4.5 years, and to assess their language abilities and their speech abilities and make sure that they're on track and getting the proper interventions that they need.
They also work with patients who have suffered strokes and head trauma. Our therapists use specialized equipment to help patients with their speech, voice, and swallowing.
We work with individuals that have had, say, a head injury, and they're going to have many cognitive deficits. Their memory may be affected, their thinking skills, their reasoning, and not just their speech. And so we work with interventions to help them develop strategies to overcome those things. It has been so fulfilling and enriching in my life.
If you're interested in a career in speech pathology and you enjoy working with people and you enjoy science, you're interested in anatomy, physiology, language, then it would be a great career for you.
Speech therapists must successfully complete a speech therapy program and earn a master's degree and/or doctorate degree. Audiologists work with patients who have hearing, balance, and related ear problems.
Audiology is a field in rehabilitation where we work with hearing impaired individuals. That can be children, it can be adults. If you're working with adults, you primarily will do diagnostics, which means you'll be doing hearing testing. You'll fit hearing aids, and you'll even work with cochlear implants. If you're working with kids, you're doing very similar procedures, but in a very different way. You'll still do some diagnostic testing or hearing tests. You'll also work with hearing aids, but you'll work with them in a very different way than you will with adults. It will also involve some sort of rehabilitation in terms of teaching kids how to work with sound, because their brains have never heard sound before, and teaching their brains how to work with speech. When kids have hearing loss, it affects their education, it affects their social life, and so being able to give them that opportunity to learn how to talk, to take part in a normal education life, really opens up avenues for them, and that's very rewarding for me.
Audiologists must successfully complete a doctorate in audiology.
I had a private practice for 10 years. I've worked at 2 other corporations, and I don't think there's any doubt in my mind that working Intermountain has been the highlight of my career.
Intermountain Healthcare is one of the nation's top integrated health systems. We are known throughout the world for our quality and excellence. One of the most exciting things about Intermountain is our ability to implement new techniques quickly and effectively. This is due to our dedicated and talented therapists who are supported by state-of-the-art equipment and facilities.
Our gym here is amazing. We have a force plate treadmill, which is unique throughout the world, that they can do a lot of research in, and it's just a unique place to work. There's nothing like it anywhere else, I think, that you can compare it to.
Our rehabilitation services have brought many Olympic athletes to our facilities for treatment. The Orthopedic Specialty Hospital, TOSH, is the training facility for the Olympic speed skaters, and many Olympic skiers have also received treatment at TOSH for sports injuries.
I don't know how U.S. speed skating would function at this point without its affiliation with TOSH. They have been so good to us and make our program so much stronger than it otherwise would be.
Our therapists are leading the nation in breakthrough research and are featured presenters at most national conferences.
We're doing things that other folks might not even be doing at this point in time. We're providing state-of-the-art care.
Our team understands that giving the very best care to our patients and their families means more than having exceptional technical skills and the best equipment. We go out of our way to show our patients that we care about them as individuals and that we are there to give them our very best.
It's one thing to treat your patient, but it's another thing to know your patient. It's that extra something special.
We all make the effort to make sure that when a patient comes in with a family member or by themselves, they leave our office knowing that each person, each staff member, whether it be a physical therapist or an athletic trainer or somebody who sits at the front desk or an aide, has done everything possible to make their experience with us positive and meaningful.
We invite you to be a part of our great team.
Rewarding,
challenging,
caring,
and innovative.
For more information about careers in rehabilitation, go to intermountainhealthcare.jobs.